Tell us a little bit about yourself.
I grew up in Modesto, California. It's where I had my children, got married.
How long did you live in Modesto?
33 years.
Okay. So up until 33, you're in Modesto. And then is that where you started to experience some health challenges?
Yes, actually was really healthy. I had graduated from nursing school, had had my son, and then I got pregnant with my daughter really fast after my son was born.
Mm-hmm.
And it was about 8 months into my daughter's pregnancy when I developed heart palpitations and just wasn't feeling very well.
So when you say heart palpitations, what were you experiencing?
It kind of felt like a flutter or like my heart would skip a beat.
Mm-hmm.
And it would almost take my breath away and I would have to cough. Sometimes it would flutter to the point where I would have to hit my chest to make sure that my heart actually was beating. And I was exhausted. I wasn't feeling well.
Mm-hmm.
And I just kind of put it off that it was because I had a 1-year-old at home and I was 8 months pregnant.
Yeah. I'm exhausted just hearing that. So, you had torticollis as well, right?
Right.
At what point did that show up?
That didn't develop until 3-4 years later. And I was at Costco getting a box of diapers off the shelf. And my kids were on one side, but the box was heavy. And so when I pulled it down, it pulled me really hard to my left.
Mm-hmm.
And my neck instantly tightened up. And I was like, oh, I think I hurt my neck.
Uh-huh.
And then I woke up the next morning and it was completely seized up, turned to the left. My shoulder was up. And I was like, wow. I went and saw a massage therapist thinking I must have just pulled something.
Yeah, pull something, muscular type of an issue.
And as she would massage it, it just got worse.
So you paid for massage, you
Yep.
left feeling worse.
Yes.
Okay. What did you try next to address the torticollis?
I went just to my PCP. I tried muscle relaxers. They didn't help. I had a CT scan, which was normal. They decided to send me to a neurologist to see what was going on. And the neurologist said, oh, you have torticollis, which I've heard of torticollis as being different. I heard you can be born with it and other things. It didn't seem like a normal torticollis. That's what he said I had developed. And so he suggested Botox injections.
So you've got a torticollis diagnosis and the solution was Botox injections. Did they explain why Botox?
They said that the Botox would relax the muscle and it would allow my head to be upright. I would just have to go back every 9 weeks and have it done.
So essentially, I mean, that's what it kind of paralyzes the muscle, right? It basically allows it to not contract.
Right.
Okay. Did that work?
Yes and no.
Okay.
So my first injections, it did work, but within 24 hours, I developed a fever of 102. That fever remained. I called the doctor and said, hey, I have a temp, and he said it was unrelated and to not worry about it.
Completely unrelated. Okay.
And I'm like, okay, but I could move my neck. But about 4 weeks into it, I still had a fever of 102, and my neck was starting to tighten down. I called him back and he said, well, this has nothing to do with the Botox and we probably won't be doing the injections again. And I said, well, if it has nothing to do with the Botox, why aren't we doing the injections again? And he said, well, I don't want to take the risk. The fever lasted for the full 9 weeks. At the end of 9 weeks, the torticollis was actually worse than what it was before. So my ear was completely on my left shoulder. My shoulder blade was actually on top of my spine. It was so drawn in.
I mean, can you even move your head and shoulder into that position right now?
No, I hate to because
you don't want to
but it was more like that.
And that was like you wake up in the morning.
I laid like this. I got up. I moved like this. My arm was completely up and I can't even get my shoulder blade back where it was.
Wow.
It was like completely on top of my spine.
Okay, so round one with Botox didn't quite turn out well. It sounds like your body interpreted that as an infection of some sort as well.
Right.
And by the way, how long ago are we talking? Like, when did this all kick off?
In terms of years, it would be 22 because my daughter's 21.
So 22 years ago, this thing starts with heart palpitations, and then you have this incident at the store with torticollis. So then you're 3 years into that, and then what's the story from there? Where do you go from there?
I was pretty frustrated. I kept having massages. I did some cranial treatments. The cranial treatments did help. They at least helped with some of the pain, but it didn't help with the fact that my head was contorted and my body was all twisted. There was nothing I could do about that. I started losing weight. I started developing fatigue. I was struggling to focus. So I had a lot of brain fog. I was an oncology nurse in Oregon and I mixed chemotherapy, so it was kind of scary when I would have an episode where I have no idea what I'm doing. I have to mix this drug. And I was so tired, I needed to lay down. I would stand in the mix room and cry and go, okay, I've got to get through this. I need to finish this. I have patients that their lives are depending on me. So I'd get through my day. I missed my children's young years because I would go home from work. I would go to bed. That's where I would stay.
So at that point, fatigue had become a real
Yeah.
part of this story as well.
Yeah.
Do you have any idea how many hours a day you were sleeping?
If I got off work at 4, I would come home. I rarely ate dinner. I would go to bed and I would sleep until the next morning when my husband literally had to drag me out of bed to go to work. And then on the weekends, I was in bed.
Just the whole weekend?
Yeah.
Wow. All right. So what were you trying at that point to figure this thing out?
I went ahead and went back to my PCP. They did blood work. They couldn't figure it out. They actually sent me to a psychiatrist because they thought that I maybe had some weird form of depression or something was going on there. My massage therapist who did cranial work, she had gone to the Upledger Institute in Florida. And so I actually sold my car to get enough money to go to the Upledger Institute in Florida. Saw Dr. Upledger himself. This was another experience. So I had 5 days of 8 hours a day treatment. I laid there. I had a lot of cranial treatment. I did acupuncture. They also had psychiatric evaluations. And then Dr. Upledger saw me twice. And when he first saw me, he's like, "You do not have torticollis." He goes, "I'm not sure what's going on, but you don't have torticollis." He goes, "But let's see if we can get your neck straight." And he just snapped my neck. And I was like, "Oh my goodness." And he goes, "Your neck's straight." And I said, "No, it's not." And so he had to get me a mirror. My shoulder was still really elevated, but he had my neck straight. But as soon as I had the mirror, within a few seconds, started going back down. And he goes, "You don't have torticollis." He goes, "But I don't know what's going on." So I spent a week there. Most of the doctors in Oregon had written me off. They wanted nothing to do with me. And so I just kind of maintained. I did what I could. I ate what I could.
Just coped.
Yeah.
So we're further down the road now. At that point where the cancer shows up?
No, actually, we moved from Oregon to Colorado, and that was 11 years ago. And I went and saw another neurologist, and I thought, okay, let's see if someone else has a different idea. She also thought I had torticollis and started the Botox injections. This time I did not develop a fever, and they helped. Every 9 weeks I would go and have it, but then I started developing twitching in my legs and a vibration in my body, and I'm like, okay, something's going on. And I had this feeling like I was on a boat. So I wasn't spin dizzy. It's like being underwater and you're messing around and you're grabbing things and you kind of don't know where up is if you've like done somersaults under the water. Yeah. And I didn't know where up was. So I wasn't dizzy, but my sense of balance, everything was off. I had no idea where up was. So my neurologist didn't know. So she sent me to another neurologist that specialized in this potassium deficiency. They did a bunch of tests and the guy's like, "You don't have anything, but I can physically see your legs twitching." My muscles would twitch. So they thought, let's try dry needling. So we tried dry needling. Well, when they put the needle in, my muscle would hold onto the needle and wouldn't let it go. So they couldn't get the needles out. They would spend 15 minutes waiting for my muscle to let go so they could pull the needle out. So I did Botox injections until I developed a severe reaction to it. I developed a high fever and I couldn't breathe. So I was on oxygen for 9 weeks. And at that point, a friend of mine had mentioned, "Hey, have you tried something different? What do you think about functional medicine?" Things like that. And that's when she introduced me to Thrive. I was desperate at that point, came in, and I really didn't want to see a chiropractor. They scared me. So She was very kind. Within about 10, 15 minutes, she told me she thought I had Lyme. I told her, "I'm a nurse. I've never been bit by a tick. I do not have Lyme." She said, "Okay, we'll just let it go." She did a bunch of testing, found out I had some food sensitivities. She started detoxing me, doing things like that. About 6 months into it, I was not really getting any better. So I went ahead and agreed to the Lyme test. She ran it and I was positive for Lyme.
What did you think when you saw that?
I was shocked because I didn't think how that was possible. I have never in my life been bitten by a tick. I've never even had one on me. I didn't see how that was possible.
How did that start to make sense to you that it was possible?
She introduced me to Dr. Naylor, and I went and saw him, and we went over my labs. Not only did I have Lyme, but I had 2 co-infections, Bartonella and Babesia. And he started going through it, and he's the one that told me that you don't have to be bit by a tick, that biting flies and mosquitoes can also carry Lyme. Mosquitoes are really bad in Modesto, and I was bit all the time. So at any given time, I could have been bit.
So backtracking then to the cancer episode, that happened whenever you moved here to Colorado?
Yeah.
And how long did that last?
I developed cancer 3 years into Lyme treatment. I went through chemo, surgery, and radiation, so the whole process was about 9 months.
Were you ever concerned? I mean, at that point in the journey, like, hey, this is just not really going my way.
Yes. Emotionally, it drained me. I was frustrated. I wasn't getting better. I didn't understand why I wasn't getting better. My symptoms were getting worse. Between Dr. Molly and Dr. Naylor, they're like, stay with us, hang on, let us get you through this, and you're going to come out on the other side. I trusted them.
Was there a point in time in that journey that you perceived like, hey, we just turned a corner? Like, there's all these negative turns in this story, but when did you feel for the first time, hey, that's a positive turn?
I don't know. I've had a couple of those.
Yeah, the breathing was big, I think.
Yeah, because I went through a period where my diaphragm would spasm and I couldn't breathe and I didn't know what to do. So the first thing I did was call Dr. Molly and go, hey, I can't breathe. So I came in and she was able to work with me and get my diaphragm to stop spasming. But it seemed like it was forever.
I know, but in your head was still stuck to your shoulder. There's still 3 years even cancer. And we've done nutrition. I mean, it's a loose term to say we've done chiropractic. You know, as chiropractors, we believe the body heals itself and it's smart and it's got something in there that still works. So it's really everything we did was just keep pulling tools. We're like, maybe that could get smarter. It was honestly just what we kept building on. And it's almost hard to remember how many things we've done. We've tried so many different things. And we'd be, that worked. Oh yeah, that worked. And so we'd go from like literally her feet would turn in and wouldn't let go. So she'd walk in and after working all day and not sleeping. And so we did some things that found would release her feet. So like just getting walking was such a big deal. It wasn't the manual adjustments that you probably think of with a chiropractor, but the philosophy's the same. Your body can heal. We just got to figure out how it can get there. Literally created in the moment that don't make sense on paper, never learned in school, but we'd be like, that worked. You can walk. There were little wins like that. Over time, we're like, well, if it worked there, let's do it over here. And, you know, so we got these little tiny wins. I do remember you texting me because I remember where I was walking. Like, I can breathe. Breathing. My speech came back. You know, there were just so many little layers over time. I mean, that's a long list. You haven't moved your head, neck, and shoulder for 13 years. Even as chiropractor, you know, walk in and I'm like taking the x-ray and I'm like, where do I begin? Like, I don't even know where to start. There's that in-breathing and talking and walking and you can't exercise. It gets worse. You know, there's the heart palpitations. The list is just so long. And then not to be sleeping on top of that was just, you know, I mean, she's tough. I mean, I was very inspired for many years, just be like, I have nothing to complain about. And so she'd get through just so many little wins like that I think kept us going, because then we just kept making stuff up as we went through that. I would say now I'll have Lyme patients come in and I have a whole lot more tools that I know kind of right where to start and how to get a lot of function back a lot faster, I think.
So you beat cancer and then you were able to breathe again, it sounds like. Were there any other moments in this journey that you said, wait a minute, that's different. I can do that again. Or I haven't done that in years.
Oh my goodness, there's so many. The speech was a big deal. I don't know how long I was unable to talk. And I don't even know why I couldn't talk. That was really frustrating. It limited my ability to work with patients. It limited my ability to talk to my physicians. It was ridiculous. So when that came back, yeah, that was a big win. But there are so many things. I don't know how many times I've left Thrive and been, oh my goodness, you're a genius. This has been amazing.
And I'm literally like making that be like, tell me if you hated this, but we got to try it.
Do you remember how far along in? Because it looks like the torticollis has resolved.
I would say yes. I think there's more residual now because of how many years my shoulder was up. My whole back had twisted up like this. So it's almost learning how to get my posture back. And so that's kind of a process now. It's like, okay, this is what I've been doing. I mean, things work faster now. I'm able to exercise for the first time in, I don't even want to say how long.
20?
Maybe.
Yeah. 22.
20 years.
20 years. And that's sad because I love to exercise. But I couldn't even walk. Dr. Molly had me, okay, start taking small walks, start getting out there. And I wouldn't want to, but I would. And I would go out and I would like, oh, okay, that was a bad idea. It flared me. Now I'm frustrated because I wanted to be out with my kids. I wanted to go camping. I wanted to participate in their activities and I just couldn't do it. It just was frustrating. The little wins, you just have to take them a little bit at a time. And for every one step I took forward, I took 6 back every time up until recently. And now I'm taking 9 steps forward, on occasion 1 step back.
And they're short-lived. They're not weeks and weeks of now, you know, trying to undo something. It's like you went on a long car ride and just the pressure on the seat, on our legs, that took us forever to get that.
Yeah.
So that just would, anything sets it off, it's now months to get it back. But we went from literally 4 days a week for years. And then it was exciting and we were a little nervous. Be like, you think you can do 2? It's only been the last 2 years.
Yeah.
Yeah. 2, maybe 3 at the most. We're like, okay, let's try 2. And then we're like, 1, are you sure? That's new. So it's gone well. It just is, it's taken that long to get to where we're at now.
What did you think the first time you met her?
No one taught me this in school. I thought, no. Like, you go through all the things that haven't worked and you're like, you don't have a real diagnosis. Because that was my first question, is if you're seeing a neurologist, I mean, they're pretty smart. They had probably found some rare disorder that I've never heard of, some, that you have, and they figured it out. And that was kind of where we started, was there really wasn't a diagnosis. And to me, how do you do treatment without a diagnosis? You're guessing. So that bothered me, I think, just intrinsically. I didn't think you should have treatment without knowing what you're treating, especially if you've already been a specialist. So that's where, for me, it was like, we've got to get better answers than what you've already gotten. That was kind of step 1. Step 2 was then just, once we figure out what it is, then what do you do with that? Had your head glued to your shoulder for 13 years, as a chiropractor, like, they didn't tell me how to do this, there aren't really studies on it enough to talk through that. So we just kind of, a little piece at a time. We knew we couldn't really do adjustments. We still don't do much of that. Not really.
You've done
I don't know if we
adjustment on
call
occasion.
it that, but we do little baby ones. But it's more about balancing things. And that's kind of where we've learned, but it took a lot of just patience and trying things.
So 10 minutes after meeting her, you start talking about Lyme.
Yeah, it's funny you remember that. It's a long time ago.
I do, because it was such a shock when you did that. I was like, you're crazy.
Yeah.
And this was a mistake coming here. You think of, I always attach Lyme to a tick.
Yeah.
And so I'm like, there's no way. There is absolutely no way.
This was just a few months after another patient had come in and had the same heart palpitations, had the heart monitor she wore for 24 hours, or they do a full 30-day one. Anyway, they tested her heart was fine, but her heart keeps racing. So she comes in and says, hey, guess what? I figured out what was in, because it was the heart palpitations and constant knee pain. I go, what was it? Because I felt her knee felt fine. I don't know why you're in constant pain. You have no swelling. There's no reason you should have that much knee pain. So I don't know what it is. So she said, it turns out that was Lyme. I'm like, you can get Lyme in your knee. Is that really real? And so that was causing heart palpitations and her knee pain. And she was only like 25, maybe 30. She's young. From that point, I started looking at pain differently and started looking at things as potential infections, not just you injured your knee and it's going to swell. That's where really our education ends for both chiropractors and medical doctors. Kind of opened up a whole new world. I mean, we've diagnosed, I would say, probably 30 people since then. Just that young too. I think the youngest was in her 20s and constant foot pain for 6 years. She's in physical therapy every day for 6 years. Something's wrong. So that's kind of what, as a natural health doctor, we're kind of the gap stop, and this has gone on too long. You can't keep going the same direction with no answers, and medicine will do that forever. You've been on Botox, same story for a long time. We tend to kind of like pump the brakes. Let's get answers. Let's look outside the box. And that's really kind of where any of these results come from, is hanging out there. Is just going, well, that didn't work. I'm going to keep going outside the box until, one, we get answers, but then we get results. And there's many times I'll look at her and go, I don't know what we're doing. I didn't learn this. Nobody taught me how to do this. And then something would work. I'd do the opposite of what it should be. Don't stretch it. Do the opposite. Really, that worked. So let's do it again. And let's do the next area.
You'd had a similar patient diagnosed with Lyme, and they had a similar symptom set.
Yeah, exactly.
And so you were like,
That was my first time hearing that that's possible.
Mm-hmm.
So it's not in medical chiropractic nursing education. It still hasn't made it there.
Well, it sounds like treatment in Stephanie's case was very personal and customized, that you weren't really operating out of a traditional manual for handling that. What did you find was most effective?
It helped though with a nursing background because we could have almost like medical conversations about tissue and how tissue responds and neurology. And most people don't know, chiropractors know all this stuff. They're like, don't just pop backs. And yes, but there's more to it. And so we could kind of brainstorm through blood work and markers and why this was elevated and how that contributes. And we were blending both sides of kind of medicine and kind of the diagnostic side of things. We had blood work. I mean, we just kept pulling things going, let's order this and let's see if that kind of builds more of a story for us. So it changed how I look and how I treat because the body's got so many things it interplays with. So things like an iron anemia where it's not Lyme, it's not a disease, but it gets missed. And so those are the little wins that would kind of like build it back in many different aspects. You know, we say a functional medicine approach. It's because we're looking at the body in terms of how all the biochemistry coordinates together, how all the structure coordinates together. And then where Lyme really, I think we both learned over time, really loves to live in the fascia. And what her head was doing is the fascia, which is like, if you ever take chicken skin and you peel it off and you see all that gluey stuff underneath it, that's the fascia. There's different types of fascia, but that's kind of a good example. It's not muscle, it's not skin, it's somewhere in between. So it's hard to treat. It doesn't contract like a muscle does. Muscles shorten and lengthen. And this is more like Chinese finger cuffs. So it'll actually just like shorten and then it'll lock. And then the Lyme will go in there and hide. So that's been the only thing that makes sense in terms of how we treat it and how we got her walking and her head moving again, is we would actually go into that fascia and focus on that and release it. I literally had to make up stuff, and that's what works. That's what we do now.
How do you feel today then?
I'm cancer-free and I feel good.
1 out of 10.
I would say most days I sit at a 10. I do have days that I'm a 9. I mean, I'm still on medication for Lyme. I'm still going through treatment. And so I will take a treatment and I'm like, oh, I feel horrible. And I'll feel horrible for 5 days. And thank goodness I try and take my medicine at about the same time when I know at about that time is my day to come in here. And Dr. Molly will find where it's at and go, okay, this is what we need to do. Then that eases the symptoms. I go home, feel better, and I go about my life. But it's nice to have my life.
I mean, 10 out of 10 is remarkable.
Compared to where I came from?
I mean, compared to anyone. I mean, I can't go out on the street and ask anyone how they feel, and I'm not going to get too many 10 out of 10s.
Here's the thing. They haven't been at rock bottom either. Do I have aches and pains? Yes. Am I going to have aches and pains? Probably. I'll take a walk and have knee pain. I'll take a walk. It doesn't go away. But comparatively speaking, I'm living my life, and I'm going to say I feel a 10 out of 10.
And like great sleep, good energy, can exercise, go on vacation.
I feel like I can go get groceries and not have to sleep in the car on the way, before I go home. And I can make it through dinner now, cooking without laying on the ground and going, I can't do this.
You'd have to take a nap preparing.
I would. I literally couldn't even walk to the couch. I would have to lay on the kitchen floor because there was no way I was keeping my eyes open.
And I don't think you traveled for a solid decade, right?
No,
So,
my kids actually joke around because we've taken our first vacation 3 years ago.
Wow. For anyone that would watch this and they're dealing with there's a whole category of symptoms that just kind of get moved into the we don't know, can't really handle it category, like fibromyalgia and those types of things. For someone who's dealing with those types of symptoms, I understand your issue is different than that, but that whole frustrating merry-go-round of go see a practitioner, get something other than an answer, and then try again and try again. Someone's kind of caught in that place. What words of encouragement would you have for them?
Basically just hang in there. If you live anywhere near Thrive, I would get in with Dr. Molly. If it wasn't for her, I wouldn't have my life. I mean, there were many times I remember texting you and saying, don't give up. Please don't give up on me. I can't do this. And she never did. There are going to be symptoms that come up, and the emotional roller coaster is horrible, but just hang in there. And it's gonna get worse. But if you can get the help you need, a medical doctor is not gonna do it. He just won't.
Dr. K, you've, this isn't your first rodeo with Lyme's, and it's not your first rodeo with, I would say, some of the mystery illnesses of the world, where they're just not easy to figure out, 10 minutes in, sure. But for most people, it's not a very easy thing to put their finger on.
Yeah.
So if someone's struggling, they're kind of caught in this, I don't have answers, but my symptoms are getting worse.
Yeah.
What recommendations would you make to that person?
So I always tell people that, so chiropractors have this background of, we're trained as primary care doctors. We treat things naturally. And there's this core belief with all chiropractors, the body heals itself. That's just our foundation from how we do everything. So what I find is, because we have that understanding of pathology, physiology, diagnosis, I understand disease, but I understand more of the mechanics of the body, of how it got there. And so I always say doctors have the information. They should go 3 questions deeper to get a little different answer. And that's where I find the time we spend with patients is we're like, whoa, hang on, what'd you say? It's kind of this investigation that we're doing. We're like, say that again, but then what happened there? And just that time that doctors used to take with people to just go, because often people come in and they go, I'm sorry, I'm saying too much. I'm like, you're not saying enough, probably, is the truth. So it's the time to really go, for you, what are all the pieces? Because we didn't know she had Lyme and anemia. That took time to keep putting the pieces together. So that's what I love doing. And I'm passionate about helping people, 1, get an answer, and 2, get an actual treatment that you get your life back. I say vacations because that's the one thing that people just give up on, doing fun stuff for themselves. It makes it fun, and I don't know where that will go. Lyme is certainly on the table, but it's not, I don't see everybody as a silver bullet. It's not everyone. We have to spend the time to actually dig deep and figure out if that's what it is, if it's something else completely. That's where we go. Does that answer your question? I could trail off for a while. You have no off buttons.
That's okay. That's okay. Right. Is there anything else you wanted to share about Stephanie's case, Lyme in general, your approach?
Yeah. Honestly, because of her, we've created treatments that work for Lyme that I've never heard of before. It's been really exciting for us, to find something that works that I've never seen anywhere else. It's easier to tolerate than chiropractic adjustment. So a lot of people don't want to get adjusted. That isn't what we're doing, especially day 1. It's more investigation. So it's a different type of balancing type technique. That's kind of what I'll say to help simplify it, but it's approaching the whole system. That's what I would say is, if you feel like you haven't got answers, then let us help you get those and see if we can't make sense of it. But then the approach is going to be different than probably anything you've seen.